Stop taking these diabetic medications. Today, we will discuss popular and cheap diabetic medicines that most doctors recommend, but I advise you to oppose this outdated assumption. You will know why now. Hello everyone, if you are looking for exclusive deals, blogs, educational content every week delivered to your email, subscribe to our newsletter at SugarMDs.com right now. We'll discuss, number one, how do sulfonylureas work? Number two, the mechanism of sulfonylureas. Number three, why can sulfonylureas cause weight gain and low blood sugars in diabetics? Number four, does kidney failure affect the way the glipizide, Glyburide, Glimepiride, all the sulfonylureas work? Number five, can these medications be used without adverse effects? Number six, what are the less known side effects of the sulfonylureas, which is glipizide, Glyburide, Glimepiride, and so forth? Now, sulfonylureas are routinely prescribed, right? Again, if you don't know what they are, glipizide, Glimepiride, Glyburide, in the US at least, once or twice a day, typically 30 minutes before the meals, and sulfonylureas can be taken alone or with metformin. Now, what they do is they stimulate the insulin production with or without glucose. Sulfonylureas cause low blood sugar and weight gain by continuously producing insulin. Doesn't sound good, right? Well, this video, we're going to discuss the long-term effects of glipizide, Glimepiride, and Glyburide, right? And these are called sulfonylureas. They aren't the best drugs. They're old, okay? Now, sulfonylureas, they have side effects, they have issues, they're becoming more and more clear. And sulfonylureas, number one, as we said, they cause weight gain, they cause low blood sugar, they cause beta cell failure, and even heart problems. So why we are condemning these medications so much, right? Well, the scientific evidence, along with the weight gain and low blood sugar, that definitely makes them less popular, right? But how do beta cells react to glipizide and all that medications? Well, pancreatic beta cells, as you know, they produce insulin. And sulfonylureas may increase the beta cell failure, according to research, and this was actually shown by those large studies, UKPDS or ADAPT studies, because with the sulfonylureas, you cannot sustain the glucose control in long term. Even American Diabetes Association says that sulfonylureas are not recommended because following an initial improvement in glucose management, they are typically associated with a persistent rise in A1C and progressive loss of beta cell function because they're constantly stimulating your beta cells, causing them to fail. Again, beta cells go into something called apoptosis, and in the long term, there will be very poor consequences because of beta cell failure. Now, individuals will end up needing insulin sooner than later when they are on sulfonylureas because they typically stimulate your beta cells without giving them a little rest, and they end up burning out, okay? Now, I always approach them with caution because of that exact same mechanism that I talked about. Some people lose efficacy with sulfonylureas within 1 to 2 years. Some people can take it 5 to 10 years, but if I was diabetic, it wouldn't be my first choice at all. Again, according to studies, researchers found that it can cause and worsen heart attack outcomes. So let's say you have a heart attack on sulfonylureas versus you're not, you're going to have worse outcomes. Again, it can aggravate the heart attack hormones, can complicate things quite a bit. People who take sulfonylureas end up dying more when they have a heart attack, okay? So let's dive into a little bit more about how these things really work. We also have some short-acting form of that called meglitinides or repaglinide or nataglinide. They also promote pancreatic insulin secretion and they lower your glucose. Now, because they stimulate insulin secretion, they are only beneficial in people who have still functioning pancreas, right? It's not going to work for type 1 diabetics. But why do they cause weight gain and low blood sugar to begin with? Well, since they cause continuous insulin production, you must be eating to prevent low blood sugar because your insulin level is not determined by your blood sugar, which typically what happens in a healthy individual. Even if your blood sugar is less than 70, when you're on the sulfonylureas, your blood sugar will continue to go down unless you eat something. And as a result, that's counterintuitive. So we tell patients, hey, minimize your carbohydrate intake and exercise, etc. And then we give a medication that will create insulin all the time. And guess what? They're going to end up going low, and then they're going to end up eating. So what's the point, right? Well, how about the kidney failure? Can you take this? Well, kidneys metabolize these medications. So since the kidney metabolize them, Sulfonylureas, except the ropaglutamide and the meglitinides, some of the meglitinides, most people with kidney dysfunction, the risk of low blood sugar will go up because they are not going to be cleared from your system as fast. So we see a lot of hospital admissions because of these agents, especially in elderly patients who are taking these medications. You have to be extremely careful to watch for low blood sugars, especially when the medication dose is too high. We tell people, look, there's no point of jacking up these medications because you're going to eventually crash, and that's not going to be pretty. Again, there are some forms like Glyburide or extended release Glimepiride, they can definitely accumulate in your system way more often. If you're drunk or malnourished, you're definitely at high risk for blood sugar drops as well. So the bottom line, if you have kidney disease, if you have heart disease, if you have gastrointestinal problems, I would say really that would be your last option. Salicylates, sulfonamides, fabric acid derivatives, or warfarin, they actually inhibit the clearance of sulfonylurea, so you may end up with more medication than you need, which can cause low blood sugars. So another question, who can use these medications effectively without side effects? Well, there are a couple of different types of diabetes. One is MODY3 and MODY1. They really respond well to sulfonylurea because they are not type 2 diabetic. That's a different class of diabetes. They have a defective enzyme which is fixable with sulfonylureas, but those type of patients are not as common. But most type 2 diabetics really are not good candidates for sulfonylureas due to that frequent low blood sugar episodes and weight gain problems. So what are other medications as an alternative to sulfonylureas, right? If I'm not going to take this medication, what am I going to take? Well, there are a lot of medications out there that wouldn't induce weight issues or low blood sugar issues, right? And if you are stopping the sulfonylurea, you should probably be using something else instead. You can use our advanced glucose support if it works for you, and I think for most people it will. But for people who cannot afford those or who cannot afford to take sulfonylureas because of the side effects, you are looking for some alternative medications as well if you are not able to control your diabetes with diet and exercise and so forth. You will definitely have some other adverse effects from other medications as well, but it's probably going to be easier to deal with than the side effects that you're getting with sulfonylureas. Now, what I'm talking about Ozempic, Rybelsus, Trulicity, Victoza. These are very effective medications. We call them GLP-1 drugs. They actually cause weight loss instead of weight gain, unlike the sulfonylureas do. And they actually don't lower your blood sugar too much unless you're on insulin and sulfonylurea at the same time. These medications actually also benefit you from a heart standpoint. They can reduce your heart attack and stroke risk as well, provided that your insurance covers that and you can afford it. Now, studies suggest that sulfonylureas may actually increase the risk of heart attack, as we talked about, but the GLP-1 class is totally opposite. You can also use GLP-1 class with a kidney failure, except Bydureon and Byetta. The next class is the SGLT2, which I'm sure a lot of you are taking, like Jardiance and Farxiga and so forth, the most commonly. They also has been shown to reduce the heart failure and heart attacks, also improve your kidney function on the long term, as well as lower your weight and your blood sugar levels without necessarily causing low blood sugars. Now, metformin and pioglitazone are the two generic medications that are still popular. Most people don't like it, metformin or pioglitazone, but because pioglitazone actually causes weight gain, they're fairly cheap. They don't cause low blood sugar. We know that the pioglitazone and metformin does not cause low blood sugar, but the pioglitazone can cause weight gain. Now, when you compare sulfonylureas to metformin, which one is better or worse? Actually, when you take sulfonylurea, your risk of dying from these medications are 24 to 60% more than metformin. So some sulfonylureas increase your risk of heart failure compared to metformin. Octose reduces your risk of death by 31 to 39% compared to metformin. So yes, pioglitazone is even better than metformin when it comes to some benefits, but there are some other side effects that you will not like, such as weight gain due to water retention and so forth. And in some people, pioglitazone can actually induce a heart failure if you're also on insulin. Now, if you are not able to take any of these medications or you have objections to them, well, check out our website, visit SugarMDs.com for our wonderful supplements. Most of my patients under my observation, of course, they will stop a lot of medications when they go on our supplements. Now, when you go on our supplements, you need to still discuss with your doctor that, you know, that your blood sugars are much better now. Can you stop other medications, especially if you're developing low blood sugars? Let's say you start taking our supplements and your blood sugar is down to 60, 70. Tell your doctor, look, do I really need this insulin anymore? Because my blood sugars are down to this level. And then they will probably cut back on your insulin and maybe even stop your insulin. So there you have it. Now you know what to take or what not to take. And we'll see you in the next video. Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it. And if you did, watch this video right there. I think that will help you too.